PCCEP is a community-led organization committee here tasked with soliciting information from the community and elevating the voice of the community. So this is the Behavioral Health Subcommittee chaired by Amy Anderson. It's one of the 4 kind of 5 subcommittees of PCCEP. I say 4 kind of 5 because 1 is the steering committee, but other than that, there are 4 other subcommittees, and they're all equally awesome. These are the group values of PCCEP, and again, I see that other folks have joined, so I would just add to this. Please use the chat box sparingly. Please don't post your questions for PCCEP members or the compliance officer in the chat box. There will be ample time for community comment as well as community questions or city questions. But when folks post in the chat box their questions, it becomes really difficult to track, and we want to make sure that we're getting to all of your questions. So please wait until you're called upon to ask your question or pose your comment. Switch that. Yeah, please keep your sound off unless you're talking. If you don't, then I'm just gonna go ahead and mute you. And I assure you, it's nothing personal. We just wanna make sure that the folks who are supposed to be talking and who have the time to talk are the ones talking. If you're not a presenter, please turn off your video so we can focus on those who are presenting, so we can watch. When you are about to speak, please feel free to turn your video on and turn off your mute. And this meeting is being recorded. Not all the subcommittee meetings are always recorded. Sometimes there are instances that it's important not to record from a community perspective, but this meeting will be recorded and posted on YouTube. In case of a Zoom bombing, staff, myself and Claudia will work hard to end that as quickly as possible, and I apologize in advance if anything like that should happen. Yeah, other than that, just—
You're going to upload the meeting to YouTube, so I'm not going to worry.
And that's one instance that I had to mute again. Nothing personal. But please email me if you have any questions or if you want information forwarded on to the PCCEP committee. I'd be happy to do that. We just had our youth subcommittee meeting yesterday, and it was great. We have some youth on today, but please email me any questions, comments, or concerns that you may have. And thank you all for being here. And Amy, please feel free to take it away.
On. Okay. Good evening, everyone. Welcome to August Behavioral Health Subcommittee meeting. Tonight we have 2 events we're going to talk about. One is the COCL report, because it's time for us to do the quarterly report. And the second half will be Lieutenant Casey will be furthering the education piece on the BHU unit. So thanks, Casey, for being here. We do have quite a large group, so maybe introductions in lieu of time would be start for PCCEP members, and then we may have to just move on after that, because I can see there's a lot of folks in the room. So I'm going to start out. I'm Amy Anderson, your co-chair of PCCEP. And whoever else is a PCCEP member, could you please introduce yourself?
Hi, I'm Ann Campbell. Welcome, everyone.
Who else is on here?
I can see. I'm just going to call on PCCEP members. I see Elliot.
Okay.
Hi, Elliot Young, co-chair of PCCEP. Welcome.
Thanks, Elliot. Lakiana?
Lakiana Drury, other co-chair of PCCEP. Great to be here.
Thanks, Lakiana. Taji?
Yeah, Taji Chestnut. Thanks.
Thanks, Taji. I believe that is all of the PCEP members here. Yes, that is all the PCEP members currently on the call.
Okay, so since we're, got a little late start, let's go ahead and start with the COCL report. And who is going to be presenting? Tom, or who else do we have? I can't see everybody's name, so.
Dennis, hi, Amy.
Hi.
I think I can start.
Okay.
Tom, do you have the PowerPoint that we brought? We'll try not to bore you with too many details. First, I just want to thank the Behavioral Health Subcommittee for inviting us and allowing us to say a few words. The report tonight covers the period, as it says here, from April 1st to June 30th. So it doesn't cover the most recent activity in Portland, and we can come back to that later if people need to comment on that or would like to. We know there's a lot of strong feelings about the protests and what's been going on in Portland, but we will deal with some of that in our third quarter report. So Tom, can you go on? There's been, even in the second quarter, a lot of dramatic events that affected PCEP, affected the Portland Police Bureau, the COVID pandemic in late March, and that led to more calls for service being handled by phone and probably longer response times, I believe, but more managers working from home, less in-person training, and I'll cover some of that in a minute. The daily protests against racial injustice, as you know, began in late May, and it affected PPB in big ways. Their resources for the entire Bureau were redirected to the protests, including officers and civilians at all levels of the organization. So Tom, you want to move on to the next one, or I don't know who's, Claudia, are you controlling?
I'm controlling it.
Okay. The questions we're asking in this quarter remain the same. It's part of our job. By the way, this is the maintenance year again, where the Bureau was found to be in full compliance in January of this year, and the question is, will they stay in compliance? So have they sustained these systems that they created that were needed for reform that took several years to develop those? And have they continued collecting data and analyzing data to identify problems and trends and provide feedback to themselves about how they're performing? And have they continued to conduct these self-evaluations and make adjustments as needed, as you would with a learning organization? Now, our overall assessment for the quarter is they were able to sustain these systems under extreme circumstances, although marginally at times. There were some things that we've suspended judgment on for now, including the training. But we'll come back to that in a minute. But this was largely, to a large extent, before the protests had fully taken off. And let's go to the next slide, because the issue about the protests, we did not address this question in this quarter. And the main reason we did not have the reports and the data were not immediately available to us. We've requested those for the next quarter so that we can give an analysis of that. We'll be addressing that. But our focus here is on the terms of the settlement agreement and even on the protests, and whether the Bureau has maintained these systems around force, accountability, training, and has engaged in policing that's constitutional and within the policies of the Portland Police Bureau. So we will come back to that next time around if there are comments about it tonight, and I know there might be, so we're willing to listen to that if there's time available. So let's go on. The next one, Tom, why don't you go ahead and talk about use of force during the second quarter?
Sure. And like Dr. Rosenbaum said, one of the reasons that we didn't address the protest force is because the protest began in late May and early June. Our report came out on July 7th or somewhere around there. So we want to make sure that we're giving the due diligence to the uses of forces that have occurred during the protest. So our assessment of the use of force in the maintenance year largely is consistent with how we assessed these sections in our last maintenance year or last maintenance quarter assessment. In so much that the directives remain in effect, the legal basis for using force, the post-force requirements for reporting. We've looked at PPB's evaluation of report writing to look at the accuracy of the reports, and we've seen a improvement, even though it was largely comprehensive and largely accurate in their reporting. We still see improvements quarter over quarter. So with officers, with sergeants, and with command staff, providing complete evaluations has shown improvement even over the last quarter. The force inspector continues to have quarterly meetings with our RU managers, looking at reporting deficiency trends, looking at individual officers who may warrant a little bit extra review by the RU managers or by the supervisors, group trends and precinct trends. And from all of these trends and all of these quarterly meetings that happen, the RU managers then is required to provide a formal response to each of the potential issues identified by the force inspector. Additionally, the force inspector reviews force cases and looks to identify potential training issues, potential policy issues, and potential personnel issues. Most of the things that were identified by the force inspector were sent to the RU manager for a debriefing with the officer, talk with the officer about maybe doing this or this. It's not a policy violation, but it's a way that officers can improve. 5 cases were sent to the training division for issues, potential issues related to pursuits, transitioning from weapons, the size of CEWs, suspect and officer safety, and 1 case was sent to the policy review team to look at potential policy issues related to officer safety. And I also want to say here, we're not just trusting PPB's analysis of these cases. We also conduct our own sample of force events to look at whether the evaluation process is working. We out of 20 cases, we found that all force events were reasonable. We did identify a potential issue with how PPB defines force in 1 case. But other than that, we see that these cases are reasonable under the totality of the circumstances. This is also part of our report where we look at individuals and force to custody rates. These numbers don't include protest force events. However, when looking at the number of individuals who force is used against and the number of individuals who are put in custody by PPB, there's still that maintenance of around between 3 and 3.5%. And this has been consistent for the last 2 years. And then I'll hand it over to Dennis to, oh, I'm sorry. Let me do one other thing on this. I apologize. While it's not shown here, we did also evaluate the use of force on persons in mental health crisis, the people who meet the ECIT criteria. And out of 314 calls in the quarter that met ECIT criteria, there was a total of 10 uses of force. And of those 10, 6 of them were category 4 force types, which are the least serious force options, are the least likely to result in an injury. So again, 314 ECIT calls, only 10 of which involved a use of force. Dennis, now I'll hand it off to you, sorry.
Okay, thanks, Tom. Training now, we again use the same evaluation standards that we have throughout, looking at these dimensions. Did they conduct a proper needs assessment to look at the needs for the training needs? And that's in progress right now for this year. They're working on that. We recommend that they give special attention to the community's voice in what the needs are for police training, given the Black Lives Matter movement, and also that we recommend they give attention to crowd management. And In terms of evaluation systems, we've always been very intense about ensuring that they evaluate training carefully. They are continuing to do that, but with the trend, there was an enormous change from in-class to online training. And so that system is less extensive than it was before. Some of the metrics were lost with this conversion. Now, that, for example, the surveys that were done in class of officers who are the students, asking them about the instructor and the class. But I think they're going to hopefully try to pick that up at some point. There's still the knowledge tests and being done. Analysis and reporting of force data, they're required to do that. That's continuing. The presentation to the Training Advisory Committee, which I believe was scheduled in March, was delayed because of the coronavirus, and they did in fact go ahead in July, and that'll be covered in our next report. Documenting, they're required to do that. Any officers that have missed training or those who have completed training for certification, et cetera, that's documented on Portland's LMS, their learning management system. And that system actually has become very central to their training now because a lot of it's online. Now, delivering high quality training, have they done that? Let's go to the next slide. Obviously, the virus and the protests have had a large impact on the training. So in-service training, which is for all officers, started in January and February. It was suspended in March due to the virus. Instead, just a little more than half of the officers who were not able to come to the training academy, what they did was watch an online videos that were taken during the February class of training, which we observed. We were moderately satisfied with that, and just in the sense that we were at that training and it was pretty thorough, but there are limitations that I'll talk about that in a minute. When the protests began in Portland, they stopped all the in-person classes, including training for new recruits and supervisors. So that's a concern. And our overall assessment, our assessment is in progress. And there's a lot of basic questions. Is the current training that they're getting in this post-COVID and post-protest world sufficient? And what have they done to address the training gaps that have occurred and what's being planned? So we expect to get more of that information in the next quarter. We don't have it right now, but we have talked about these problems in some detail in this report. We can go to the next slide. I just want to give kind of a little 101 here on methods of training. I spent a lot of years thinking about training. And so on the left side, there's in-person training in the classroom, which is very important to have a dialogue about with the students and the teachers interacting and exchanging ideas and answering questions, and voicing their opinions. And they're acquiring knowledge about a particular topic. The topic could be anything. It could be use of batons in crowd control or something. But then there's exercises. Exercises are hands-on, where students learn how to apply this knowledge and practice the skills that are associated with that knowledge and get feedback. If I stick with that example I just gave, it might be how to use a baton themselves and how to get feedback about how they're holding it, how they're using it, etc. So it's from academic knowledge to actual exercises. Now on the virtual side, there's kind of a static virtual, which is what Portland Police Bureau has been using lately, where at home officers are watching videos of the training that occurred in February in the classroom. And then could be more interactive virtual. Zoom is a good example. We're having that kind of interaction tonight. We're talking to each other, we're exchanging ideas, asking questions. Anyway, right now, Portland Police Bureau has elected to provide the virtual training with static videos. Obviously, there's some limitations to that. Our hope is they'll expand their methods in the near future, because the ability to interact with instructors and stay engaged and the ability to practice skills and get feedback on your performance are really essential components of knowledge acquisition and skill development in humans. So let's go on and training recommendations. So we're suggesting go beyond the static videos to more interactive modes. There have been budget cuts, as you guys probably know. Where my concern is I would hate to see, and I'm an old person at this point, and I've seen many organizations when there's budget cuts, they go back to basics and they get rid of all the things that are cutting edge and innovative and recent. I'm not saying PPB has done that, they haven't, but I'm saying please don't do that, especially in de-escalation, procedural justice, implicit bias, officer wellness. These are important topics that the Bureau has added in the last couple of years. I think they need to be kept and even expanded. You know that I'm a big fan of procedural justice, and I believe that even under stressful times when there's a lot of words being exchanged and anger, that it's so important to remain dignified and respectful. With community input and as I suggested earlier, and the lessons learned from the protests, I'm recommending we re-examine and reinforce crowd control, crowd management training, including the role of supervisors in that process. And also I recommended that PPB add training on peer intervention, which is essentially helping officers, creating that as part of the culture, but also showing them how to intervene with peers that may be at risk of getting themselves in trouble. The Floyd incident is an extreme case in Minnesota, but where peers should be able to stop or prevent harmful actions. Too often in the police culture that doesn't happen for a variety of reasons we don't have time to talk about. But I see that there's some effort in Oregon to add that to the law, to not necessarily have, but just to be required to do that. It doesn't say you have to train on it, but obviously there's some good peer training programs out there that we recommended. Okay, Tom, your turn, go ahead.
So with Section 5, community-based mental health services, again, the city and PPB have continued to play an active role in a number of committees, subcommittees, and organizations. So the Behavioral Health Unit Advisory Committee, the Behavioral Health Coordination Team, Unity Transportation Work Group, Oregon Behavioral Health Collaborative, and the Legacy Community Outreach Group. So there's still that active role through the city and PPB to play their part in community-based mental health services. And again, our approach to assessing this is what can reasonably be expected of PPB in the city, given that mental health services is a much larger system than just the police. In the same way, the Unity Center continues to operate. We had a long discussion in our last report about how it operates in accordance with the Memphis model of crisis response, and how it mitigates the potential for criminalization and reduces the resource burden on PPB. Going now into crisis intervention, the BOEC, their policies still remain in effect, and they have still conducted 16-hour CIT training for all new employees. They had been doing in-service training. Obviously, COVID has impacted that. They've taken alternate training approaches with email reminders, with flyers that are put around the office. But just, since they can't do the training, at least attempting to do training in some respect with that. They continue to do ongoing audits and find that the telecommunicators have taken the correct action 97.7% of the time. This is consistent with prior findings, and they have the ongoing relationship with Multnomah County Crisis Line, where they have the ability to connect, the MCCCL has the ability to connect with service providers rather than sending a police officer out there. For the PPB, all officers continue to receive 40 hours of CIT prior to being able to take independent call and graduating the Advanced Academy. Again, as Dr. Rosenbaum had said, there is annual in-service that includes crisis intervention. However, COVID has impacted that, and once that's been resolved, we'll reassess at that point. ECIT officers, there was a class in November that was the most recent class. I believe that the total number of ECIT officers is now about 130, I think 136. It's in the report. I just didn't have the number right in front of me. In accordance with the Memphis model, they still retain the normal patrol duties, and PPB has also retained the selection and retention criteria for who may be an ECIT officer and who may not be. Similarly, the PPB continues to use the mental health template as a data collection tool. This is used to evaluate the ECIT program with quarterly evaluations, as well as a larger semi-annual evaluation. One of the things that we had noted in past reports is with non-ECIT calls, whether there's differences between ECIT officers and non-ECIT officers. And one of the results that consistently came up was transporting to hospitals. So let me just do a brief interpretation of this. What you see in April of 2018 through September of 2018 was a larger difference between whether a person would get transported to the hospital. This is the probability. The non-ECIT officers have shown a steady increase in their decisions to transport a person to the hospital. So this gap between ECIT and non-ECIT is narrowing. This is one of the things that we are looking for identifying what kind of calls non-ECIT officers are able to handle. And as this gap narrows, we're more and more confident that the criteria for what should or should not be an ECIT call is being adequately distinguished by both BOEC and by PPB. There's also two secondary response groups that we've been calling them. The first one, the Behavioral Health Response Team, the BHRT. These are 5 teams of a pair of ECIT officer and a mental health professional. They have now a team for the houseless population and a team for follow-up with prior BHRT clients, as well as a team in each precinct. The community members are referred to the BHRT through the BERS system. They are evaluated as to whether they meet BHRT intervention criteria. And over the past 2 years, we've generally seen acceptance rates between 45 and 55%. So about half of the people referred to the BHRT are receiving follow-up services. This is the weekly caseload. One of the reasons that you see this increase in the last 2 years or so is the addition of those 2 other teams, as well as because they have a houseless population BHRT team. They can spend more time in trying to locate those individuals to connect them with services. So just when you see the caseload go up, it doesn't mean that the BHRT teams are necessarily overworked. It's that they've expanded the number of teams that they've had, and the populations that they're working with, they're able to spend a little bit more time trying to locate them in order to get them connected to services. And finally, there's the service coordination team who facilitate provision of services to individuals who are chronically houseless, who suffer chronic addiction, and are chronically involved with the criminal justice system. There has been, we've demonstrated in past reports, a positive impact on employment and police contacts. Additionally, Portland State University does an annual capstone study class, which does an evaluation of SCT every year. And they've shown that the cost benefit analysis, there's a lower cost to the county compared to if the individuals were just put through the criminal justice system. So this is the service coordination team referral status. Again, approximately half, a little bit less than half every quarter are accepted once they've been referred. Finally, the Behavioral Health Unit Advisory Committee acts as an advisory body to the Behavioral Health Unit. In the first quarter, they discuss things related to their community engagement plan, their goals for 2020, and received a presentation from the Multnomah County Local Public Safety Coordinating Council. We observed the May 2020 meeting where they finalized the community engagement plan, and they reviewed the learning objectives for the ECIT refresher training that would have been occurring. I believe now it's been pushed to later this month was the last I heard, but again, because of COVID and because of the protest, once they do the ECIT refresher training, we will be observing that. And finally, I know Lieutenant Hetman is here. Members have also been participating in this subcommittee, the Behavioral Health Subcommittee. Moving to the Employee Information System, the EIS, it's a system which uploads data from a number of different areas, from force events, traumatic incidents, complaints, commendations, uploads them nightly, and there are predetermined criteria for creating what's called an alert. Those alerts then are reviewed by the EIS administrators, and a decision is made as to whether to forward to the RU and then ultimately being forwarded to the supervisors. So generally, we've seen increase in the number of interventions that have happened. This past quarter, there was a little bit of reduction, but a single quarter's trend is not a trend. This broader trend is what we've been focusing on, but we did note that there was a reduction in this quarter. And essentially just making sure that the right alerts are being forwarded to supervisors, the one which would benefit most from an intervention. As part of, this should say Section 7 right here, I apologize. As part of Section 7, supervisors are required to conduct evaluations of employees, review of the EIS system, both on an annual basis, as well as when there's a new transfer to a supervisor. We noted in our last report there was a reduction in the 116B compliance, which is new to command. That reduction has been resolved. We noted an issue with the chief's office for this quarter, and we made the recommendation that an email be sent out so that everyone is aware of what their expectations are when there is a transfer of command. Moving on to Section 8, which is accountability. We've noted, we said that a good accountability system has a number of different elements, one of them being access. How are you able to get into have a case reviewed? What we've seen is that complaints can be submitted to or initiated by PPB and IPR. And one of the things that we've looked at over the years has been the administrative closures by IPR. So there's been a steady reduction over the past 6 years. And one of the more astute community members of Portland also questioned whether that was a reason because force cases must receive a full administrative investigation. So whether this was a function of that. So what we did is we looked at the data for non-force cases, and we still see this reduction in administrative closures. So even when removing the force cases, which must receive a full administrative investigation, the number of cases have been going, the number of administrative closures have been going down. This may be because, well, it's likely that this is also because supervisory investigations and precinct referrals have gone up. These are cases that often would not have received any type of investigation, and that would likely have left the community member feeling ignored or dismissed. But by having these lower level investigations, there can still be a sense of restorative justice, still be a better relationship with the community, not have it be an administrative closure, but also not take up the resources to do a full administrative investigation. We've also noted transparency and expediency are two hallmarks of a good accountability system. Transparency, there's a good bit of transparency in the Portland system. There's online tracking of cases for individuals who have filed the complaints. CRCs are open to the public. There are PRB summaries that are put out, and the IPR website contains data related to complaints, as well as a number of other elements. Expediency, we've continued looking at ensuring that all administrative investigations are completed within 180 days. There still remains a fairly high percentage of cases which do meet that 180-day timeline, as well as IPR and PPB putting in the work to ensure these things. So there's ongoing evaluations, there are weekly case meetings, and both IPR and IA have identified trends and identified ways to address them. There remains consistency in checks and balances in the accountability system, consistency with mirrored policies, joint training between IA and IPR. And again, the point of that is to make sure that regardless of which entity investigates it, you're going to have a consistent approach to the investigation. We've also audited 20 cases. We looked at administrative closures, supervisory investigations, precinct referrals, full investigations, both by IA and IPR, and have found that the investigations are, the findings of the investigations are reasonable. We've looked at the discipline guide to ensure that discipline is consistent and predictable, and the discipline decisions that we've reviewed do demonstrate that. There continues to be a system of checks and balances with IPR review of RU manager findings. The CRC is an appeals body, and the PRB then makes a final recommendation on discipline. Finally, Section 8 accountability holds certain requirements for OIS events. There were an OIS, I'm sorry, is officer involved shootings. This also involves in custody deaths, may not necessarily involve a shooting, but lethal force events. There were no lethal force events between December of 2019 and June of 2020. So in a 6 to 7 month span, there was not a single OIS event. So what we had to do was rely on our historical analysis, that there continues to be separation of witness and involved officers, that there are walkthroughs and interviews of witness officers. There's Garrity protected interviews of the involved officers, that CROs are issued and that CROs remain in effect until the end of their grand jury, and that a grand jury occurs. And I'll turn it back over to Dr. Rosenbaum.
All right, thank you, Tom. Now we get down to you guys, the folks on the PCCEP and your role in community engagement. So we're talking about stuff that you know about better than we do. In the second quarter, you did get back to your monthly virtual meetings after COVID, and you also held a town hall with us, which we appreciate. And after George Floyd's death, you held a series of strongly attended listening sessions to give voice to the community against racial injustice. I think that's very impressive. Lots of turnout for that. By the way, I forgot to thank Amy Ruiz on our team, who I think is on tonight, but she's in Portland and has been very helpful with us in documenting PCCEP's role. You've maintained a working relationship with the Portland Police Bureau and other organizations, such as the AMA, the Albina Ministerial Alliance, and the Mental Health Alliance. And I know you've expanded. I know since then, I know you're working with TAC, the Training Advisory Committee, and some of the accountability oversight groups. So we appreciate the work you're doing. And you've increased your recommendations on police reform. And so, in a nutshell, you remain what we say is a legitimate body of community engagement, and we're pleased that PCCEP is functioning well. Tom, can we go on to the next one? or did Tom leave? There he is. This is just a sample of some of your recommendations that the city should work with Oregon lawmakers to introduce legislation to change the legal doctrine of qualified immunity for police officers, support the current bill that's related to arbitration and police discipline, banning certain PPV weapons used against demonstrators, defunding the police and refunding our communities. That's a very big topic. And with lots of different meanings for different people. Strengthening restorative justice practices, mostly I believe with youth. Accelerating the city's plan to launch a Truth and Reconciliation Commission. And some of these things have happened. Change policy and training to strengthen officers' duty to intervene, which I had mentioned earlier, and reduce the use of force in foot pursuit. So these are substantial recommendations that you folks have put forth. So in terms of community engagement, Section 9 also covers the city's role and the PPV's role. The city has continued to assist PCCEP as it seeks to maintain its membership and train new members and staff the meetings and provide the public with virtual access. Many of those things are being realized this evening. The Bureau has continued to provide data collection, analysis, and reporting of demographic data and work with PCCEP as needed with regard to stops and force and that sort of thing. And has continued to work with a variety of community organizations that's been more constrained since COVID, but you go to their website, you can see the many things that they've done. I think most impressive here, Mayor Wheeler's police reform action plan calls for a couple of things related to PCCEP, the community-led review and revision of core police services convened by PCCEP. It was spelled out, that's why I just summarized it there. And local legislation enshrining PCCEP in Portland City Code, making it a permanent community oversight body. So I think these actions by the mayor are a testimony to the fact that he has confidence in PCCEP and that the city council has confidence in PCCEP, and that hopefully your future will be solidified and as an official city oversight body. So, and that's it for us. We want to we'll turn it back to Ann and to open up this up, and we're happy to respond to questions. I do just want to say that, as it says here on the screen, by this Friday, since we've had our report out for about a month, we'd like to, if you have any last minute feedback and you don't get a chance to say it this evening, or even if you do, please feel free to send it to our email, and we'll certainly take it seriously, but especially with regard to our report. Thank you.
Real quick, just to, I don't mean to interject. I know that in typical fashion, PCCEP comment is first, and I know that Taji had his hand raised, so I just want to give space for PCCEP comment, if that's okay with you, Amy.
Sorry, I got to turn the mic on. Yeah, absolutely. Go ahead, Taj.
Okay, thank you so much. And thank you so much, COCL, Tom and Dr. Rosenbaum, for your awesome report. It's really informative, and it's awesome that you were able to sit in and hear about some of the work that PCCEP's doing and sort of legitimize some of its work as well. I did have a series of questions, but I'm going to just stick to the highlight ones. And overarching, I guess my question first would be, in your next report, I'm assuming you'll be discussing in a variety of detail around the protests that have been happening since the beginning of June all the way up until today. What does it mean if you find from that report that the city is not in compliance with former use of force and training, that you've all seen them, pass through training, pass through policy moves that show that they're doing it, but then they're not in compliance in a substantial manner come these last 2 months, 3 months or so?
Okay, well, that's a really good question. First, I want to ask people to call me Dennis and not doctor. I get tired of that. In terms of the protests, yes, we will be giving it much more careful attention. Hopefully we'll get the documentation we need from the city to help more seriously drill down and evaluate that in the context of the settlement agreement. America. We're trying to keep ourselves in those boundaries if possible. Now, if you raise a really important question, if they fall out of compliance, this is the maintenance year, right, where they have to stay in compliance. I'm going to punt this a little bit to DOJ, because there's a compliance officer and our team, we assess whether that we believe they're in compliance, but it's ultimately DOJ's decision to decide whether they have in fact fallen out of compliance. We're kind of recommending to them. And then if we do find that and DOJ agrees with us, it becomes an issue of interpreting the settlement agreement. So the city and DOJ would need to negotiate what that means. And it does say that, so there's issues of how long it would, so they have to come back in compliance, and then they're supposed to remain in compliance for a year. Does it include all the paragraphs of the settlement agreement, or just the ones that are out of compliance, which would be a limited number, which is probably what it means, but I'm not going to interfere with that interpretation. And then the second thing would be, for how long do they, is it still the same? Because the settlement agreement is kind of vague about these matters, other than the fact that there needs to stay in compliance for a year. So that's the best I can do at this point. But in the end, it's DOJ has to step up and see whether they agree with us, if we did reach that conclusion.
And then the last important question, I think it's just overarching around training considering COVID. I heard from a lieutenant and multiple folks who work at the training division that when they do trainings, traditionally they have to do it in, and I could be wrong on this, so if anyone from training or PPP wants to correct me, but that they end up having to do a lot of their training for in-service on the yearly basis or using overtime, which is sort of that budgetary issue again. So how, considering a budget cut that existed this year and assuming that it's not going to be just to increase next year and they'll be fine again, that how will you ensure that they're still getting that, not how will you ensure, but how will, you know, they as the Bureau ensure that they're still delivering high quality training, whether it's even just getting, you know, members to the facilities for those 40 hours or so per year?
Yeah, I mean, you are definitely onto some important issues here. I think I'm going to just leave it at this. I'm going to say that our job is to look at that training, as we did already, but we're going to do it again more seriously next quarter and the fourth quarter, and say, does this meet the conditions of the settlement agreement? Is this a good training? I said tonight that I have various standards we do about what constitutes good training. And I think that in the end, the fact that they use, it is true, I believe, that they use a lot of overtime to run the training academy, the training division, and that's a management decision. Other departments don't do that. Some do. It just depends. But how they get to that training that's their problem, not mine. Do you know what I'm saying? I'm saying, here's the bar you have to jump over. You figure out whether you can come up with another way to do that. So.
Thank you so much.
Real quick, I know we're going to get to Ann Campbell's question and then Elliot Young's question, but I do see that we have two representatives from the Department of Justice here on the call, and I know you haven't had time to prepare any response or anything like that, but if you want to say anything to Taji's previous question, that I want to give the space to respond, if you want. If not, no worries.
This is Jared. You guys hear me?
Yeah, we can.
As I understand the question, it's what happens if the Portland Police Bureau or the city falls out of substantial compliance. I think Dennis answered it correctly from the COCL's perspective. The Department of Justice is the monitor in the case, and will, assess compliance when it's appropriate to do so. And there's a lot of stuff going on, and documents and data still being collected. So we're not prepared to do that yet, but we do take the compliance officer's report and read it, analyze it, do our own independent analysis. We have our own experts who look at the data, look at the compliance officer report, and we get together as a team and assess, what our view of the situation is. I don't have any authority right now to opine on a particular provision of the settlement agreement, and it would be inappropriate to do so now. But we are looking at stuff. As the settlement agreement is written, if the city falls out of substantial compliance before sustaining it for a year, there can't be a motion to dismiss the case. There has to be 1 year of sustained substantial compliance in the view of the monitor, which is the Department of Justice. And the earliest that could potentially be is, I think, January 10th, 2021. And so, that's an early date. If they fall out of substantial compliance, they would have to sustain it at some point for a year in order for there to be a dismissal motion. And I can pass it to Jonas, who's done these cases his whole career with the department going on. I don't need to say how many years. But Jonas, if you want to be able to add something, I think I'll pass it to you.
Unlike some agreements, this agreement does not have a partial termination provision, which means we would not terminate this agreement absent any modification. We would not terminate this agreement in pieces. It's supposed to be terminated as a whole once substantial compliance is maintained for a year. I agree with Jared's answer. I think that's accurate. Dr. Rosenbaum, not to disagree with you, but I don't think there's necessarily a provision by which we would only monitor certain parts that fell out of compliance if that were to pass. But to echo as a take-home message, Jared's answer, we are not yet making a determination. The Department of Justice is the monitor, and we rely upon data produced by the compliance officer. We also do independent assessments with our monitors, with our experts that we use. The report that we produce would speak for itself without making any predictions on what the report would say now. Thank you for the opportunity, Theo. And Ann.
Yeah, thanks so much for taking the time to talk. I'm sorry I didn't give you more time to prepare. So we're going to go to Ann Campbell and then Elliot.
Thank you, and thank you for this time. I have a question about training as well in the report. It is noted that you're encouraging PPB to give attention to the views and experiences of the community in the training 2021. What was your anticipation as to how they would get that information?
Thank you, Ann. Well, again, there's many different ways of approaching this. We don't want to be dictatorial in telling them exactly what they need to do, but what I've seen in other places is there's working groups created with the community to talk about these trainings, and there's also some places that go further, and I know Portland's done a little bit of this, where the community is involved in the training, and they do some of the training, or they participate in the training. So there's different levels of involvement, but certainly up front with the needs assessment here, a group of people from various parts of the community that are able to say, here's what we liked and didn't like about the way things have been going lately, or the way the protests were handled. So, I think, again, that's a local thing that we just want to say, please pay attention to that.
So just a quick follow-up. So then that decision is left up to the police bureau to carry out. Is that correct?
Yes, yeah.
Okay, thanks.
And certainly you folks could recommend things as well to them. Thank
Am
you.
I up? Okay, so thanks Dennis and Tom for that presentation. So in reading over this whole report, and thank you for the very thorough report, spent a good part of the day reading it, I was struck with the sort of cognitive dissonance that I have being on the ground in Portland and hearing from over 750 community members. The report seems to suggest substantial, well, it does suggest substantial compliance, but also that all of these measures that are in place are working fine at a precise time when the national, international press, and local press has been highlighting the overzealous policing of protests, which includes, as you must know, over 100 instances of tear gassing of Portlanders by the Portland Police Bureau in June and 2 days in May. Mayor Wheeler has even apologized for this overzealous reaction and its infringement on the constitutional right of Portlanders to protest. In addition, we have condemnations by House Speaker Tina Kotek, Senator Lou Fredericks, City Commissioners Hardesty and Udaley. So I understand that you don't have the data from the Police Bureau on what happened in June in terms of the police protests, but I believe that you have substantial data from the press, from lawsuits that have been filed against the city for their infringement on the constitutional rights. And it strikes me as strange that the report would try to, in some general terms, address some of the information that is publicly available to the entire world. So I would encourage you to include some of that and say, we're still waiting on this other data to investigate in more depth. I think without that, I read it as kind of negligence or a willful ignoring of events which occurred in June, which are part of the reporting period. And of course, we're in August now, so there's plenty of time to include what we know from those June reportings. And I'm happy to provide the evidence that I've collected, including a citizen journalist who documented each use of tear gassing by the Portland police.
Okay.
One other question is whether the fact that there was no community involvement in the choice of a new chief of police is concerning, given the emphasis upon community engagement. In terms of the oversight bodies that you mentioned, as you talk about it in the report, it seems that everything is working fine. Candace Avalos, who's the chair of the Citizen Review Committee, wrote an opinion piece in the Oregonian who talked about the work of the CRC as theater of oversight. The City Council has unanimously recommended a ballot referral that would completely work the oversight body, indicating that the current system is not transparent or independent. So again, cognitive dissonance from what we hear from every city leader, from what we hear from the people on the oversight bodies themselves, from what's in your report. In terms of PCCEP, you know, you do talk about our recommendations, but I think that it's not untrue what you state, but I think it's partial. So when you talk about PCCEP saying that we were in compliance, as you know, there was a discussion and a vote to indicate that PCCEP believed that the city was not in compliance with the spirit of the agreement. So I think including the totality of the discussions of what the PCCEP recommends would help provide a more balanced view. That goes for our recommendation on the banning of tear gas. You say that the mayor directed the police chief to limit the use of tear gas. We had that discussion and we decided as a body to recommend the complete banning of tear gas and use it under no condition. So I think indicating that there is a discrepancy there would help provide the court with a more accurate reading of where PCCEP stands and where the city stands. Other things that I find puzzling is why protest use of force is not included in the force data reported on the website. That's something which is clearly of interest to Portlanders, to the world. The fact that that's not reported on the website suggests a lack of ability of that data to tell us what's really going on in the city. And so what I would suggest is that some preliminary assessment of the police conduct based on the number of misconduct complaints, which I believe is higher than anywhere else in the country in June, the use of tear gas by police, the lawsuits of those injured by the police, including journalists, legal observers, and peaceful protests, would help to balance your report and provide a more robust information to the court. So I'll stop there.
Thank you, Elliot. You've made a number of very thoughtful comments that some of which I agree with. And I do think that we could mention these things in a slightly different context. You mentioned many things. I've tried to take notes here. If you feel like sending me an email or sending an email to that, we'd appreciate it so we can address those. Just in terms of the way, a little bit of our defense, we are in this mentality of this being the maintenance year of continuing to them do the things they did. We also we thought seriously about analyzing the protests, and we just couldn't get our head around it. And we didn't have the data that we felt we needed in time for this report, which a draft of which was, available mid-June. We still don't have the data that we need. Now, I'm a social scientist, so I'm a little bit less reliant on some sources than others, but in this case, I think you mentioned evidence that you have collected or others. We've asked some people for that, and we'd love to get that from you. So we're going to evaluate this in the context of the settlement agreement. Portland Police Bureau still has to not only meet the terms of that agreement, and that includes using force that's constitutional and within policy, and that there's systems in place to immediately identify when problems occur and what's done about it. So we will be looking at that. The lawsuits are, maybe we can get the names of those, but it's hard to get much detail about that right now. Just a couple, but the idea that I do agree that the report seems more positive than you would expect in light of all the circumstances of what has happened in Portland. But this idea of a new approach to oversight is interesting. I think the Portland system isn't perfect. They've managed to try to be responsive to the settlement agreement terms over the years. It took a few years to get that together, but there's still ways this is an interesting time where crisis creates opportunity to rethink a lot of things. So I'm not going to comment on that. I don't know. It seems like we don't have the details of that new possibility, and it may not be in place before the settlement agreement ends. So depending on all of that. I do appreciate your comments on PCCEP. The vote that the city was not in compliance, I don't remember that didn't pass though, did it?
No, we voted that the city was in compliance, substantial compliance, but we had a vigorous debate and voted to add a preamble saying that we didn't think in terms of the spirit of the agreement because outcomes had not seemed to change. And so in that sense, I think we were trying to talk about more than just the checking the boxes, but the spirit of the agreement. And so I think including that, I don't know if you or your representatives attend all of our meetings, but they're available, they're recorded, so you could certainly go back and hear that discussion.
Okay, thank you. Well, I should probably stop right there, but I would love to hear from you with your any evidence you have, but also your comments.
Okay, sure. I'll send that along.
Thank you.
Thank you.
Can I say a couple of things too? One of the things that I wanted to respond to was your comment about Ms. Candace, the chair of the CRC. For our last report, we actually had an extensive conversation with her about the issues that were present in the CRC, related to the relationship with the auditor's office, related to the standard, the standard that they're held, whether a reasonable supervisor might come to that. And for this report, we actually did a follow-up with her. We had communication back and forth with her, and she herself noted that there were improvements in the issues. There was training that was going to be happening with the incoming members. There was a bunch of new incoming members, that the relationship with the auditor's office had improved. So there seemed to be a real hope on that, by both the auditor's office and Candace. Also, kind of going back to what you had said about the protest events that have happened, we too have seen the videos. We've read the newspaper, the editorials. We've looked. We stay on top of this stuff as much as possible as well. One of the things that we will need, though, before we can make an objective determination is we'll need to see the police reports. One of the criteria for measuring police use of force is a reasonable officer, from the perception of the officer, without the benefit of 20/20 hindsight. And what we need to be able to do is read that. It doesn't mean that everything. It doesn't mean that reading those will exonerate everybody. It doesn't mean that everything's great. But what we have to be able to do objectively is to be able to gather information from all sides and to see all of that information, which is why with protests that were happening in late May and in June, we weren't able to gather that information. That information wasn't available to us, and it would be a dereliction of duty if we were to sit there and make determinations and make judgments without having all of that information for us to make that objective that objective determination. So again, it's not a matter of us pushing things off. It's not a matter of us trying to pretend that everything in Portland has gone perfectly. It's just a matter of us making sure that we have all the evidence that we have to be able to make a defensible determination.
Thank you all. I have to jump in. I know that we have some hands raised, but we really do have to move on in the interest of time. It is 7:43 right now, and we have one more presenter. I thank you all for the questions. Dennis, would you mind putting your email in the chat box so that people can email their questions? Community members can email them questions.
We have our general email on the last slide. Do you want to? Can we put that up, Tom?
I can put it in the chat box. It's Rosenbaum and Associates.
Thank you very much. And I know that this seems to be a common theme that yeah, that's true. It is important that we hear from the public, as this is a town hall. So I would like to see what the group wants to do in terms of this, because it is important to hear from folks, but we also have Casey Hetman on the line to speak and to present. We could push this meeting just longer. I know that's asking a lot of folks, but I do think that it's important to hear from the community about this. And I also think it's important to hear from Casey Hetman. And I know that's asking a lot, but it is important. Yeah.
Can we continue this conversation at the steering committee?
Well, it is important to, if we do have a town hall, that we have to hear from the town itself. We have to hear from the community, and we have to, like, the point is for community members to come here and be able to ask Dr. Rosenbaum, Dr. Christoph, and if they're available, their questions.
I'm noticing in the chat that Casey said that he can do his presentation at a future date.
Yeah, I just saw that too. So
Yeah, so I think it'd be great to have the community
I really
questions.
do thank you, Casey, for that. I know that in these town halls, we always go over on questions, and oftentimes question time is limited. That's been something we've done, and I know that the next quarterly report will be even, it'll have even more questions from community members as well as PCEP members. So perhaps we should identify that early and just carve out a 2.5 hour time period just for that, and not combine it with
right,
but
right.
thanks so much, Casey. I appreciate that. So then we're going to continue with questions. And again, I apologize, Casey, but thank you very much for your flexibility. I appreciate it very much. So it looked like we have, do we have any more PCEP comment before we move on to community?
I did have one more quick question in regards to the former that was just mentioned in regards to Tom expressing very validly that there needs to be a sort of comprehensive analysis of the protests and the impacts, and that's why your office did not include that in the report. And I can understand that. And my key thing there is, however, the use of force, as you mentioned in your report, they have about 180 days, which is about 6 months to respond to, and correct me if I'm wrong, 6 months to completely file any instances of discipline or complaints that may occur. What is that correct?
So there's a requirement from the filing of a complaint to I believe it's recommending discipline, but filing a complaint to finalize, completing the investigation up to discipline. That's where the 180 days comes in. So if you file a complaint with IPR, that includes intake investigation, that includes then the full administrative investigation, and the process through that.
So you may all, in your expertise in this area of policing, may see the issue there. With the 6 month time period, they have the ability for a case for an average community member who may have an issue at a protest with an officer who may file a complaint with IPR, CRC, or an instance of a supervisor seeing an instance that an officer uses use of force out of compliance, that the sort of period in which that may be reviewed and subsequent disciplinary action that may or may not even occur, considering the matrices of the PPA agreement, that it would be hard, if not quite difficult in a lot of situations to have. And you also expressed that they usually can end up being towards the 6 month period rather than sooner. That there may be discrepancies in not only which cases get filed, which cases move forward in the process that exists, but to what extent and how to ensure transparency and also consistency from point of testimony or point of incident occurring to the actual action and accountability piece of it.
So what I can say is that the use of force that occurs, the use of force that get a complaint put on them, those will go to a full administrative investigation. That's one of the requirements of the settlement agreement. Our analysis didn't, break down whether cases did go to the, to the 179th day or whether they were resolved in the 100th day. We just looked as to whether they met that 180-day requirement. So I don't have that information as to whether it was at the full end of it or not. However, what I can say, and I absolutely appreciate your point, some of these instances, some of these protest force events that do receive a complaint will go to 180 days. Should PPB maintain compliance for this entire maintenance year, that 180 days would come after. So what we have to rely on is our evaluation of the accountability system to this point. For the last however many years that we've been doing this is our 6th year now. for at least the last 2 years, we've seen reasonable administrative investigation outcomes. We've done our audits of the administrative investigations. We've looked at whether the decisions by the investigator, the decisions by the discipline, whether those were reasonable. So we've got a couple of years to look back on and say they've been doing it right for the last couple of years.
Can I stop you right there? I'm sorry, I don't mean to interrupt,
No.
but I hear what you're saying. However, just to kind of echo some things that have been shared tonight. I mean, we are in a situation that is not normal. It is not something that you have seen in the however many years you've been the 6 years. So I just want to further emphasize that this is very different. We need the information, and I want to leave it there. And I hope that we also have time for the community. Thank you.
Yeah. And the only other thing I wanted to say about that is one of the things that we're going to make sure that we look for is for the potentially problematic uses of force that we can identify, was there a corresponding administrative investigation opened up? That doesn't take 180 days to determine. If the system doesn't operate to identify those issues and to conduct a fuller investigation, a full administrative investigation into it, then that's an issue with the system. If the system does identify those and puts it through the investigation process, again, if the 180-day lapse, doesn't come to fruition by the time that we're by the end of the maintenance year, at that point, yes, I think we'll have to rely on our prior assessment of whether the IPR and IA investigators do conduct a thorough investigation. And for the last couple of years, we have seen evidence of that.
Thanks so much. If there's any last PCCEP comments, we can take one more, and then we will move on to community comments. Okay, Ann Casper, you're up.
Thank you. My computer's tired, didn't want me to speak. Okay, thank you very much. I thought Barb was ahead of me. Did Barb have any questions ahead of me? She had her hand up before me.
Barb, did you want to weigh in? I saw that your hand went down.
Oh.
Yeah, sorry, Anne. My hand was up, then it was down. My question is, does the Unity Transportation Committee really exist? Because I question that, and I would really like to find out more about them. That's it.
Like, who are they? The ambulance or the police?
So I see Mary Claire on. Mary Claire, I know that you've had more interaction with them, and if Lieutenant Hetman also wants to jump in, they do exist. It's a work group that looks at best practices in doing the transportation of persons in mental health crisis. But Mary Claire, I saw you go off of mute, so I will let you speak.
I'll just say that it does exist. It now meets or is scheduled to meet quarterly, although we missed one in April or March due to the COVID. But it's representatives of AMR, the Bureau, Unity, and other providers such as Project Respond. So it reviews any issues. It was created as a result of our changing the practice from the police transporting civil commitment holds to having that done by AMR or EMS. And so it's our way of making sure, checking in with each other and making sure that there aren't any issues or problems with that changeover.
Thanks, Mary Claire. And Casper?
Thank you. Oh, Mary Claire, it'd be great if you could get a peer on that committee. Mary Claire, actually, when we were building Unity, she got me on the transportation committee as a peer representative, someone with mental health issues. Really appreciate that, Mary Claire. And if you could do that again, I know it's a lot to ask for, it'd be great. It's always good to have somebody from the community there talking about what's going on. So I have 4 questions, and I'll just leave that. I'll just say the questions. There's a lot. You probably can't answer them. But of course, within questions, there are always statements, right? So my 4 questions are, in fact, it has to do with transportation and Unity. It's so interesting. I think Dennis and perhaps other from the DOJ remember years ago, I had asked for statistics about how many people are taken from the psychiatric hospitals or psychiatric hospital stay to jail, because there are people taken who are staying in the hospitals for some reason. I've personally seen this happen at Unity several times when I was volunteering there. So I think it'd be great as part of your data, getting data on police about, especially about transportation, how many cases are taken each quarter from the hospitals to jail? How is that transportation done? How is it going on? If the hospitals cannot basically handle people, how's that taken to jail? So that would be from the place at Emmanuel Hospital with those 4 beds, and you've got Portland Providence, you have Portland St. Vincent's, you have Unity, and Cedar Hills Hospital. And it'd be very interesting to compare if you have more taken from one hospital to another to jail, more hospitals. It'd be very interesting to compare that. And it's not easy to get that data, but as DOJ or as, I'm sorry, Dennis and Tom, if you could do that, that'd be very helpful. A question I also had to do with, as looking at Unity, now the second question is, for example, use of force at the patients, for example, at Unity, are they still using pepper spray on patients, people who are locked up there? I had a friend who was not doing well. They used pepper spray on her, and then they took her to court and charged her with assault as she was trying to protect herself. So it'd be really interesting to hear, are they using more pepper spray at Unity? I haven't heard. The third question has to do with mental health too. For IPR, how many of the cases for IPR are mental health related? The CRC and IPR. I'm just saying this because in the general mental health community, we don't even know what IPR CRC is. So I'd just be really curious if anybody are bringing things up to those places. And the 4th question has to do with engagement of the, it's called Mental Health Alliance. So it'd be interesting to find out about the compliance, about the engagement with the Mental Health Alliance with the mental health community. I happen to know a few hundred people here in Portland, in and out of different systems. We never hear from them. They never ask us anything. I don't know what they're doing. They're using vocabulary that I personally don't agree with as a mental health advocate. What is their compliance with engagement with their community? So that's 4, it's a lot to handle. The most important one for me is the numbers of people taken as patients to jail because the hospitals can't handle them. Thank you.
Just as a quick response, we don't have that data on some of those things, as you said. Some of those data points are very hard to come by, and we as the COCL, we can ask for data from the city, we can ask for data from PPB. We don't have any authority to request, or I guess we can request, but we don't have any authority to demand data from Unity or demand any response from the Mental Health Alliance. So some of those things we just don't have the ability to demand data.
Hopefully, Tom, it's not a demand. Hopefully they just give it to you.
Well, that's what I'm saying. We can request anything we want. I've requested many things in my life. Some of those things I've never gotten.
Sure. But I mean, no one's probably asked from Unity how many people are taken. I mean, I'm especially really curious about Unity, but I'd be curious about the other hospitals as well. Yeah, if you could just ask. I don't know who to ask, and I don't have a title behind me to ask.
Thank you, Ann. Tom and I will talk about this because, I mean, some of the questions may be outside of what we're focused on with mental health requirements, but it doesn't mean that if we can't answer them, that others in Portland can't. And finding the right entity to do that is important. Thank you.
Thanks so much. And I wanted to also mention that their email is in the chat box. So just in case you wanted to follow up, their email is right there in the chat box. Next, we have Portland Cop Watch, if that's Dan, I believe.
Hi, this is Dan from Portland Cop Watch. I had to unmute my phone twice. I'll try to get through my points really quickly. I don't need responses to all of them. I just want to, first of all, I do want to say thank you to the compliance officers for the report. Are you still not hearing me? For the report that had no less than 7 mentions of George Floyd in it. However, it was always referred to as a death and not a homicide, except for in a footnote. There's no less than 17 references to the protests that have been happening here in Portland, which is very important. That includes several times when you told the city and the Bureau to listen to the community, which you echoed tonight. And I remember the first report you did in 2014, where you were kind of dismissive about the community. I'm very glad to see the growth in your office as a result, I believe, of these protests. Recognizing the community, the importance of the community's voice, especially at this point in history. I would like to point out, though, that reading police reports does not necessarily get you to accuracy. It gets you to whether or not they filled out all the pieces of those reports. They don't necessarily tell the truth in those reports, as any defense attorney or person who's been subjected to police use of force will tell you. In terms of the deadly force, Dr. Christoph admitted in the chat that yes, there was a shooting at the end of June that they didn't report on because it happened too close to the end, but they missed the subject. There have been 34 deadly force incidents since the settlement agreement started, and 19 deaths, and almost all of those in one way or another had to do with mental health, even though this is supposed to be a settlement to stop mental health crises from ending with police use of force. We have repeatedly asked you to do a survey of people who've used the oversight system to see how they feel about it, because the IPR and the city stopped doing that a while ago, and that's the kind of data that you seem to always rely on, and now we're in this transition period, and it'd be helpful to find out what the problems are so they can be fixed when we fix the system. The one issue that you found that you wrote about in the less lethal round being used against a car to break the window, it wasn't clear if the Bureau agreed to start considering that a use of force. Now, we are recognizing that we have a double standard of a sort, where when people are throwing things at a building, we don't consider that to be violence by the community, but I think when the police are doing it and they're doing it specifically to get at a person, that should be considered a use of force. Also, the stop data collection questions that you said are being worked on and being trained on, there was no community input into that. So you have this whole big thing about racial justice and Black Lives Matter, and yet when we're talking about the stop data, which very heavily affects our Black community here, there was no community input into the new questions being asked. And finally, in terms of the number of dismissals of cases that come into IPR, yes, the precinct referrals, which are not investigations of any kind, it's just like a memo that goes to the precinct commander, went from 11 to 76 in the last year, and that's why the number of dismissals went down. And that is not the same as more cases being investigated, which should be the way this is measured. Thank you.
A quick response. Thank you, Dan. Your thoughts are always appreciated, and we look forward to getting your written comments. You know that I've committed most of my professional life to community engagement. I've written books about it, and so we did care about that from day one. And I do, we're trying to, now that there is a crisis, and as Ann Campbell pointed out, things are different now. And I think that it's much more important that the government and the Bureau listen to the community. And on the stops data, the community should definitely have a role in that. And so there's never too late to do that. And I think I've been a big fan of essentially what we call customer satisfaction surveys, both with police contacts and investigations. We have recommended that. They did that for a while. It was not done with the oversight. I can't tell you exactly why that didn't work. But again, it wasn't required of us. I'm trying not to step outside of my authority about the settlement agreement, and we are just making recommendations. But if they don't do the basic things, then we have to mark them down for that. So, and we agree with you on the broken window and use of force issue. So, Tom, did you want to add anything?
No.
Okay, it looks like we have a question from Susan C.
Hi, my name is Susan Cotter and I live in North Portland, and I am extremely alarmed by the fact that you say they're in compliance. It feels extremely tone deaf, which Elliot said, but for me, it demonstrates that what you're measuring is not correct. If you measure something and it comes back, woohoo, we're doing good, and everybody else says, what? You're measuring the wrong thing. How are you determining the measurement that you have now said PPB is in compliance?
All right. Susan, thank you for that. I understand where you're coming from. Elliot kind of communicated that. The answer to your question is that we were given a settlement agreement that was reached by the Justice Department and the City of Portland, like 2012 or whatever it was. And our job was to check for compliance with the terms of that settlement agreement. So, and frankly, things were bad the first couple of years. I've said that at other meetings, and we were all over their case, and there was a lot of tension. And we've managed to, and I don't want to take credit for it, but they chose to improve their behavior in a lot of ways that we've documented early on if you read many of our reports over the last 6 years. But the world has changed in the last few months, and not just in Portland, around the country. And so what you're seeing now is something pretty extreme. And so we will look at it with some of the same metrics, but behavior is changing. So,
No, that's the behavior isn't changing. You're now becoming aware of the problem.
I would respectfully disagree. I think the what's happened in the last few months is different than anything we observed in the first 5 years.
I think the symptom is the same. It's now somewhere else. Thank you for your answer.
Okay, thank you.
I want to thank you all for your time here. We are over on time, so if there is one more question, we can pose one more question. I again want to apologize for folks who came hoping to listen to Lieutenant Hetman. It is important that town halls have space for community responses and to have questions asked and answered. So I think that this was incredibly fruitful. But if one more person has a question, now would be the time to ask. Okay. Do we have any additional comments from PCCEP members? Does anybody want to say when your next meeting is, perhaps, since we have a few people on the call who may be interested in coming to another meeting who are here for the first time?
We have a steering committee meeting coming up, and Theo, you're going to remind me when it is. Someone knows, right?
I got it right here.
Okay, Anna.
It's on August 11th is the next PCCEP steering committee meeting. Settlement agreements, August 12th. Racial equity is August 20th. And then the 25th is the full body meeting. Yeah, and I don't have anything to add. I just listened in tonight. It was great to see a lot of different feedback and ideas. I feel like a lot of what we said today was said previously, just in terms of looking at a really thorough analysis of what is going on here in the city. And I think it goes without saying that we're going to be very interested to see what Q3 report looks like. And in the absence of a lot of the analysis being given in this past report, that hopefully in the next one, it will include some of the stuff that went on in the month of June, obviously the month of July, and provide those critiques. So thank you, Dennis. I'll call you Dennis, even though you're a doctor, by your request for all of y'all for your work, and encourage you to continue to give a critical analysis to what's going on.
And I would just encourage you to, I know you, Dennis, you said you're a social scientist, and you and Tom to think a little bit more like an ethnographer and anthropologist, and think about the qualitative information that you can gather from the community from listening in on PCCEP meetings, and what the community is saying at City Council, because I think what ideally your report should do, if you believe in community engagement, is reflect the community and not just be a stenographer of what the police produces, but move beyond that. So trying to think about taking the data from the police bureau, as well as taking the qualitative and quantitative data that is produced by the community.
Thank you very much, Dennis and Tom. Wherever Amy Ruiz is, thank her as well.
Yes, thank you all for listening and giving the helpful comments. It was very good. We enjoyed it.
There she is. We see you now. Well, this concludes the meeting unless anyone else has any closing thoughts. Thanks so much, all. I appreciate you. We'll see you next time.
Thank you all.
Thank you.